Hello everyone, I'm Dr. Lilian Montalvo, board certified dermatologist, and today I want to share all the information that I give my patients on their first visit with acne. So most of my patients walk out with a prescription on the first visit of retinoid cream, which is the gold standard treatment of acne. Not all of them, but most of them. So today I'm going to share the do's and don'ts that I share with my patients. As I tell them, knowledge is power. The more you know, the better you're gonna get. So this little extra time that I spend with them, that I'm gonna give all that information to you now, makes a difference between getting better faster. It does take a little bit of time, and that's important to know because you cannot get desperate. But if you know everything that you need to know, you will get better definitely from the first visit to the second. It would take about a month and a half from that first visit to the second, but it's totally worth your time and your effort. Now down to the instructions. First of all, wash your face twice a day. That is good enough for everybody. There are many studies that have been done on the different skin types, oily, dry, or combined, or different skin conditions, and all the studies conclude that twice a day is good for everyone. Use lukewarm water and use your own hands to wash your face. Then, if you need to apply the retin, you have to make sure that you apply it at night, and you have to make sure you put the right amount. This is a very common mistake. People think that if they use a lot of cream, they're gonna get better faster. That is so not true. If you put a lot of retin in your skin, you will probably burn it, and it will get back on the treatment. It will set you back a lot on the treatment. So basically, how much is enough? You know the Tic Tac, the mint, which is small, maybe like a bean, like a white bean, or a little smaller. That's good enough for your whole face. So I tell my younger patients, you go do the cross on your face and you spread it all over the face area, sparing. What I mean by sparing is not putting it on your eyes, on the side of your nose, and of the corner of the mouth. So what happens with retin very often, the first couple of weeks, people might get very sensitive because retin works by regenerating and exfoliating your superficial skin cells. So people think they're getting sensitized, allergies, or too dry, and it's not the case. The case is that the retin is regenerating your epidermis. So it's very common for these side effects to appear: scales, redness, and sensitivity. What to do about that? So one of my recommendations is to stop the cream for about 2 days. Use moisturizer. Make sure that the moisturizer is dermatology recommended. And then in about 2 or 3 days, if you feel it's better, you restart the retin. One of the tricks that I recommend, if you're super sensitive, you can apply a little bit of moisturizer, a thin layer, before you apply the retin. And that will create a little barrier and a little, you can dilute the retin a little bit by applying the moisturizer first, not a lot. So I explain to my patients that your skin will eventually get used to the retin. This is called retinized. Your skin will be retinized, but you need to be patient. This is where most of the patients fail. They get desperate, this is not working, this is giving me too many side effects, and they quit. So consistency is very important. Do not quit. Use the little tricks that I'm giving you. Stop, hold the treatment for a couple of days. Use a lot of moisturizer. Make sure the moisturizer is non-comedogenic. And then when you restart, you apply a thin layer of the moisturizer before applying the medication, just in very sensitive cases, to dilute that effect of the retin, to make it softer, and to try to create that retinization faster. If you want to take notes, this is the time to do so. So this is the summary, acne instructions. First of all, wash twice a day. Remember, with your own hands, and lukewarm water. Number 2, apply at night, p.m., and the amount is really important. It's like a Tic Tac. And I'm gonna give you a demonstration of that as soon as possible. And number 3, if you get side effects, if side effects A, hold the Retin cream for about 2 days, and then B, apply a little bit of moisturizer before applying the Retin. This will be after 2 or 3 days of resting the Retin cream. Moisturizer before treatment. So you can take a picture or take notes because this is the summary. And I wanted to visually show you the amount that we recommend because this is one of the most common mistakes. It's a Tic Tac, like a mint, okay? You apply it. This looks like more than what it is. Let me make it better. There. A pea size. So this is the amount that you need for your whole face. You spread it all over your face, except your eyes, because they can get really dry, and eyes do not have sebaceous glands and they will not get pimples. On the corner of the nose, do not use it, and on the corner of the mouth, do not use it. Why? Because it can get extremely irritated and then you would have to stop, and then the treatment would take longer. And to try to make things simpler for you, I summarized the do's and don'ts. So let's go over the do's first. So do use products on top of your pores, which include the moisturizer and the sunblock and even the cleanser, that are non-comedogenic. That means it won't clog your pores. There's another word for this, which is non-acnegenic, and they are equivalent. And nowadays, most of the products simply say won't clog pores. So people ask me, yeah, my products say non-oily. I explain to them that's one thing, but this is another thing. When we're treating acne, one of the big problems is using makeup and moisturizers that clog your pores and makes your acne worse while you're trying to make it better. So you need to make sure that the products that you use say non-comedogenic, non-acnegenic, or won't clog pores. They mean the same. Non-oily does not include these other words. So this is what we want. So what else do we want? We want to avoid the sun. So many of my teenage girls go take a suntan and they look better and they tell me it helps me. But then what they don't realize is that after a couple of weeks, acne gets worse. Maybe at the beginning, it's like makeup and it will cover up a little bit of the acne, but then in the long term, it will make it worse. So you have to make sure you use sunblock every day and every 2 hours if you're outdoors. And make sure the sunblock says that it won't clog your pores. What are the other do's? We need to have a clean hairline. So you don't have to wash your hair every day, but at least the hairline around your face has to be clean. What I recommend my teenagers is that when they get back from school, when they get back home, and they're gonna go do their homework and be at home and nobody's watching them, wear a headband to keep your hair and the oils of your hair back. And something else that you have to do, if your dermatologist recommend facials, you need to make sure that you stop the use of Retin about a week before the facial, because if not, you're gonna be way too sensitive. Every esthetician works differently, and there are different retins and different types of skin. So once they get to know you, and as I said before, you need to go to someone that is recommended by the dermatologist or that is recommended by word of mouth, not by ads. This is really important. It must be someone that has experience dealing with acne. So what I was gonna say, that the esthetician will tell you, after getting to know your skin, how many days before you need to stop that retin. So now with the don'ts. So some people are very sensitive to vitamin B12, and they notice that they get acne worse when they use this vitamin. So I just recommend everyone to stop that vitamin B12. Waxing, these are the don'ts. It cannot be done. Why? Because even if we do waxing here on the eyebrow, and that's not an area where you apply the retin, it gets sensitive anyways because of the potency of that treatment. And what happens is, if you do waxing while being treated with retin, the first layer of the epidermis will be torn away and you're gonna have a burn looking scab. So do not wax while on retin. So another thing that has been proven on studies to make acne worse in some people, it's the products like cow milk or the derivatives like yogurt coming from cow or cheese, because some of these cows apparently get hormones and they're transmitted to some people, and then they get the outbreaks of acne because of this. So that's the summary of do's and don'ts. You can take a picture of this. This is very valuable information, and these are the reasons why some treatments do not work. And I still get asked a lot about chocolate, which, as people should know, it's a myth. It's not the cause of acne, but some people do get worse with chocolate or candy. So let's use common sense, people. If you eat something and consistently wake up worse the next day, stop eating that. Common sense. Many of my patients who come on their first visit for acne on their face also comment me that they have a few pimples on their chest, back, and even in their glutes. So something that I have found that it's really helpful is benzoyl peroxide washes. The ones that I have tried and I like the most are PanOxyl Bar 10 and Oxy Wash 10. It's a bit confusing because the Oxy Wash, which is this one, here it says acne wash, but sometimes it says face wash, but it's 10%. In my opinion, 10% benzoyl peroxide, it's a little bit too much on the face, but it's really good for your chest, back, and glutes. The way that I explain my patients to use this is to let the water run down the area, then apply about 2/4 of because it's a creamy wash. Let me show you. About 2 of these. Rub the area with the product and leave it on for about 2 minutes and then rinse. With the bar soap PanOxyl, which I cannot find all the time, that's why I give 2 recommendations. You do the same. You let the water run the area, rub the soap, leave it on for about 2 minutes and then rinse. It takes about a month to see the results like the other products, like the ones on your face, but it works. Once you get better, you have to keep on using it. If you want to take pictures, now it's time to do so. These are the 2 products I just talked about. Oxy Wash, remember it can say face wash or acne wash, and PanOxyl Bar 10. The important thing is that it says benzoyl peroxide 10%. That's the active ingredient. Make sure you rinse it off well, because anything that says peroxide and it remains on your skin will stain your fabrics, your clothes. And finally, I'm going to share these 3 main reasons why treatment fails. Lack of consistency, the side effects, and using the wrong products. I will explain to you this more carefully. So basically, people think that after starting the cream, they might get better in a day or a week, and that's not the case. And I feel really sorry for them, because if they're not explained, how are they gonna know? So I tell all my patients, you have to be very, very patient and very consistent, and don't get desperate, because you will start seeing some results after 6 weeks. I also have to tell them this is not a cure, this is a treatment. So even if you start getting better and you think you're cured, it's not cured. It's well treated and you have to keep going with the treatment. In adult people, I usually tell them to do at least a year of treatment. In my teenagers, I recommend that they go on till the first year of college, because I've noticed that that first year causes a lot of stress and that might cause breakouts. And if they're not being treated, it's another stress factor. So keep on using the treatment even after freshman year college. Side effects. As I told you before, side effects are very common. Scaling, which looks like dryness, redness, and sensitivity. You will have to be patient because at some point your skin will get used to this cream, it will be retinized, and you won't have those side effects. But if people are not explained this, sometimes they see these reactions as really bad adverse reactions, as an allergy, as a bad side effect, and they quit the treatment. So knowledge is power. That's why I explain everything. I take the time, because if you're ready and you have been explained all this, you're gonna succeed. And the last thing is using the wrong products. If you are under a treatment, but you are on the other hand using products that clog your pores because you were never explained that you have to look for products that say that won't clog your pores, then it's like running around in circles. You're trying to improve yourself, but without knowing, you're making yourself worse. So in summary, the 3 main reasons for treatment failure: lack of consistency, because people get desperate, and I truly understand. Side effects, because they're very common. I forgot to explain that some people might look worse the first couple of weeks, and it's part of the deal. It's part of the treatment, okay? Very important. If you get a little worse, your acne gets a little worse, the first few weeks, couple of weeks, it's okay. That means the treatment is working. And last, wrong products. If you're clogging your pores, the medication and the treatment will never work. So I really hope all this information and all this effort and all the knowledge helps you. I invite you to like this video. Remember, my attempt is to compress 18 years of dermatologic practice and a lot of acne patients into a few minutes. Basically, all the important information is here. So if you have to watch it a couple of times, go ahead. If you have to take notes, go ahead. If you have to take pictures of my notes, go ahead. Whatever helps. So I truly hope this helps. I invite you to like the video, I invite you to subscribe, and I will keep posting good videos to help you with your skin. Bye.